have my name. All right. My name is Jacqueline Carey. I work for AMREF Health Africa, and I'm coordinating the EU COVID response program that is being implemented across 9 counties in the country, and Nakuru County happens to be one of the counties that we are working in. So the program has been funded by the EU, and some of the things that we are doing is working with the county health teams to ensure that we have the requisite capacity to respond to the COVID-19. So we are training healthcare workers who are working at the isolation sites. We are working with the community health workforce that is helping communities prepare and be able to respond to the pandemic. We are providing PPEs to ensure that we stay protected, and what we have behind us is some of the PPEs that we are bringing. We are working with the EU. We've been supported by the EU to work across the different counties, and in Nakuru County alone we've committed about 35 million Kenya shillings in to build capacities in the response. The PPEs that we have today are worth about 10 million Kenya shillings. They will be going to the isolation sites to make sure our healthcare workers are protected. We'll also be availing this at the community level to ensure that our community health workers are protected, even as they assist families, take care of the clients that are sick, even as they create awareness at the community level. We have encouraging news right now from Nakuru County. The cases are going down, the numbers are going down, and we want to be able to maintain this situation. So we continue to work very closely with the Nakuru County in the remaining months to make sure that this situation is managed and we can go back to normality, back to business in Nakuru County. So thank you very much, and we appreciate the support that we've gotten from Nakuru County.
What are some of the things that you got?
So what we have here are personal protective equipment. These are really the equipment that our healthcare workers have to wear to ensure that they don't get infected as they offer services at the health facility, as well as the community health workers offer services at the community level. And this equipment is, for example, the gowns that they have to wear. We have the face shields, the masks, the removable masks. We have sanitizers in here. We have cleaning detergents to ensure that our isolation centers stay clean. We have gloves, we have boots, and the whole range of personal protective equipment for our healthcare workers. Yeah. And over and above that, we've also come to Nakuru County today to launch our Wheels for Life program. And what the Wheels for Life program is ensure that our mothers, our pregnant mothers back at home can be able to get support when they need it. So whenever complications arise, when they're at the household level, especially at night when the curfew hours are on, then they can be able to make a phone call to 1196, be able to get support. They can be able to talk to a healthcare worker, a qualified healthcare worker, be able to triage and be able to determine if the complication requires referral to the health facility or if it's a situation that can be managed from home. And based on that consultation, then referrals are able to be made and the mother is able to be transported for free to the health facility. So what we've done is that we have an arrangement with the ambulance services in Nakuru County from both private and the public sector. And when the mother calls and they need to be referred to the health facility, then these ambulances are able to ferry the mother to the health facility to ensure that they can get the support that they need in a timely manner to make sure that we have safe deliveries and we have safe pregnancies. Thank you very much.
Yes. Okay. We've seen you flagging off ambulances. We don't know what they have. Are they part of the things that have been donated by AMREF? Or what has been going on?
Today, I want to say, on behalf of our county, I think we're happy to receive these donations from the PPEs from AMREF. This is part of the consignments that they deliver to us sometimes back, and also part of what do I say? AMREF in the past have actually helped us in training our healthcare workers, and this comes in handy because from the training we've seen some very good fruits in the sense that our health workers who got training from these facilities, they've actually been, we've seen the reduction in the number of cases in our county going down, and also even as we move towards what we call the primary the community, so we're moving to home-based care. Even as we move to home-based care, this facility, these PPEs come in handy because we've realized that with home-based care, many of our sick those people who are suffering from the virus get healthy earlier. And we realized that at the moment we have about 321 cases in home-based care. And from home-based care, we've also realized that the recoveries are 100%. And that is a good thing with home-based care, and they get treated earlier. And the cost is about 90% cheaper than if we actually brought them to the hospitals for treatment and whatever. But I want to say one other element that AMREF has brought in, which is helping our mothers in a big way, is the Wheels for Life, which has actually, they have brought in, they'll be investing about 4 million. And this is the amount that will take care of our mothers who are actually, who are in need of ambulances at home. They want to go and deliver, especially after curfew hours, because that's the time that we don't have any vehicles around. So these mothers normally suffer a lot to get means to the hospitals. So AMREF has come up with a team of sponsors to actually help bring together the ambulances from both private and public. And I want to say they are producing an app where wherever a mother calls, from whichever part of our county, it becomes very easy for them to access the ambulances, because they know where the ambulances are, they know where the caller is calling from the app, and also they know where the level 4 hospitals where these mothers will need the services are taken, so that they can receive the services they need as soon as possible. So we want to thank AMREF for actually coming up with this particular initiative, and we will actually have our county ambulances also on call, so that they assist in actually helping to make sure that our mothers, wherever they are, when they want to give birth, they not have to struggle a lot to get to the hospitals and get the services they need. As you know, we have ambulances up to the lowest level, normally up to our level 4 hospitals, and those ambulances are actually in each and every ward, and they can assist in those various places, apart from the ones which are in town and the ones which are actually very useful in our health care. And we want to thank AMREF and say we'll continue partnering with them, and we want to thank them for continued support. Thank you.